Hey everyone, we're going to discuss malnutrition today. As this journey, we would like to introduce to you our project proposal entitled Healthy Futures Combating Malnutrition. So why we focus this issue? Malnutrition is a significant global health issue that affects millions of individuals, particularly in low and middle income countries. It includes both undernutrition, such as stunting, wasting, and micronutrition deficiencies, and overnutrition, overweight, and obesity. This dual burden negatively impacts individuals' health, learning capacity, productivity, and overall well-being. These are the SDGs related to our topic. SDG 2 Zero Hunger aims to end hunger, achieve food security, improve nutrition, and promote sustainability agriculture. SDG 3 Good health and well-being address the needs to reduce health mortality and improve mental health, both affected by malnutrition. SDG 1 No poverty. Poverty is a root cause of malnutrition. Addressing it helps improve food access and health system. SDG 4 Quality education. Educate communities are better able to make informed nutritional decisions. Malnourished children also perform worse in school. SDG 6 Clean water and sanitation. Poor water and sanitation contribute to disease that worsen malnutrition. SDG 5 Gender equality. Empowering women leads to better family nutrition outcomes. Women are central of food preparation and caregiving. SDG 13 Climate action. Climate change affects food production and availability, impacting nutrition security. So, why healthy futures combating nutrition is important? It is important because conducting a program in malnutrition is crucial because it addresses one of the most serious and preventable public health issues affecting millions worldwide, particularly children, pregnant women, and elderly. Malnutrition weakens the immune system, increases susceptibility to disease, and leading to its cause of child mortality. It also hinders physical and cognitive development, reducing children's ability to learn and limiting future's economic opportunities. So that's end of my report. So next reporter will be Michi and Gloria.
So I'm the next reporter. Who is our target audience? Our target audience is children under 5 years old, pregnant, lactating women in Purok Tres, Barangay Itom Duero. Children under 5 years old are the most affected by malnutrition, as this age group is in a crucial stage of physical and cognitive development. Malnutrition during this period can lead to stunting, wasting, weakened immunity, and long-term developmental delays. Pregnant and lacting women are also highly vulnerable, as their nutritional status directly impact maternal health and fetal development. Poor maternal nutrition increases the risk of complication during pregnancy and childbirth, and can result in low birth weight and malnourishment. The next one is what attitude or behavior are you trying to change or addresses to our issue. The malnutrition programs aims to change several attitudes and behaviors that contribute to the poor nutrition, especially among vulnerable groups. One of the key behaviors to address is the lack of awareness and practice of proper dietary habits, such as inadequate breastfeeding, improper weaning practices, and insufficient intake of diverse, nutrient rich foods. Many families, due to cultural beliefs or lack of knowledge, prioritize quantity over quality in meals or rely heavily on staple foods without including essential nutrients. Another behavior to change is the low prioritizations of nutrition is household and community decision making. Many caregivers and families may not see the nutrition as directly linked to health and in development outcomes. Additionally, we aim to address the limited hygiene and sanitation practices that increase the risk of infection and worsen malnutrition, such as a poor hand washing and unsafe food handling. This program is also seeks to shift attitudes around gender roles, encouraging shared and responsibility for child nutrition and care, and empowering women with the knowledge and resources they need to make healthy decisions. Ultimately, the goal is to foster long-term behavior change that support better nutrition, health-seeking behaviors, and food security within household and communities. What are your desired outcomes? When do you plan to achieve them? We have five types. Number one is reduce rates of malnutrition. Number two is improve nutrition knowledge and practices. Number three is increase access to nutritious food. Number four is strengthening community capacity. And the last one is behavioral change and empowerment. Number one, reduce rates of malnutrition. This outcome focuses on decreasing the prevalence of both undernutrition and overnutrition. Undernutrition is such as stunting, wasting, and micronutrient deficiency. And overnutrient is such as obesity and diet-related chronic diseases within a community or population. It is typically achieved by improving access to nutrition food, better health services, and awareness campaign. Example of this is a health intervention program in a rural community aims to reduce child stunting by 30% within the next 5 years by increasing access to fortified foods, improving breastfeeding practices, and providing micronutrient supplements. The measurable reduction in malnutrition rates in this is within 3 to 5 years with ongoing monitoring. Number two is improve nutrition knowledge and practices. This outcome is about educating individuals and community to make healthier food choices, understand the importance of balanced diets, and learn practical ways to integrate food nutrition into daily life. This often involves education campaigns, workshop, and collaboration with local health providers. Example of this is a school-based nutrition program teaches children and their families how to prepare healthy meals and understand food labels. By the end of 2-year program, students will report a 40% increase in their understanding of healthy eating habits, and their parents will apply these practices at home. Within 1 to 2 years, community or specific target groups like school or household should show a significant improvement in nutrition knowledge and adoptions of healthier eating processes. Number three, increase access to nutritious food. This outcome targets increasing availability and affordability of nutritious food. This could involve improving food distribution channels, setting up food banks, increasing local food production. Example is community gardens or providing subsides for healthy foods. Example of this is a city government partners with local farmers and grocery stores to reduce the cost of fresh fruits and vegetables for low-income families. They aim to reduce food desert and make nutritious food more accessible to 100,000 residents within 3 years. This can be achieved over 3 years with specific targets such as the number of people benefiting from food subsidy programs, the number of new food access points, or a decrease in food insecurity levels in the target area. Number four is strengthen community capacity. This outcome focuses on empowering local community to take charge of their own nutrition and health needs. Strengthening the capacity might involve training local health workers, supporting community-based organizations, or creating local leadership structure for nutrition initiatives. Example of this is a non-profit organization works with local community leaders to train them in the basic of nutrition, food security, and health promotion. These community leaders will then educate their neighbors and host local events. Within 2 years, 50 community leaders will be trained, leading to sustained health promotion efforts. The capacity building typically require a longer term effort to 1 to 3 years, but it can yield sustainable changes as the local leaders and stakeholders continue to the work. The last one is behavioral change and empowerment. This outcome is focused on encouraging individuals to make long term, positive changes to their health behaviors. It often involves empowering people with knowledge, skills, and motivation to adopt healthier lifestyle, as well as providing emotional and social support to help them overcome barriers to change. Example of this is a campaign to reduce soda consumptions, and a city encourages residents to replace sugar drinks with water. The program targets 100,000 residents within 18 months. 50% of participants report cutting back their soda intake by at least 30%. And community groups are supporting this behavior change with ongoing events. The behavior change can take time, but noticeable improvements in individual and community behavior can typically be seen within 1 to 2 years, especially if there is a strong support system and motivations.
In our weekly plan, in week 1, preparation and community engagement. We as a group conduct a rapid assessment or review existing data on malnutrition in the area. And we also identify and train community health workers and also the volunteers. We distribute educational materials like flyers, posters, and radio message. We also hold a community meeting to introduce the program, its purpose, and schedule. In week 2, the nutrition education and awareness. So, we as a group conduct a daily workshop for different target groups like mothers, youth, elders. And for our topic in our daily workshop, we have breastfeeding, balanced diets, safe food handling, hygiene, and sanitation. So, in week 3, direct interventions and demonstrations. We distribute micronutrient supplements and fortified foods to vulnerable groups. And we also conduct a cooking demonstration using local, affordable, and nutritious foods. We establish model kitchen gardens or food plots in selected households. We also monitor health indicators, weight, their height, and the MUAC for a sample of children. In week 4, follow-up, monitoring, and community feedback. So, we conduct home visits to observe changes in feeding, hygiene practices, and we also collect feedback from our participants and community leaders. And we evaluate short-term changes in knowledge, behavior, and basic health indicators. And expected outcomes after 4 weeks. The outcomes it improve knowledge of proper nutrition and hygiene among at least 75% of participants. Increase adoption of at least one healthy behavior like hand washing, improved diet, and identify malnourished individuals referred to health service for further care, and a clear plan for sustained community engagement and follow-up support. So in a conclusion, addressing malnutrition is not only a humanitarian imperative, but a key step towards sustainable development. This project offers a practical, community-based solution that can bring lasting change to vulnerable populations in Porok Tres, Barangay Itom, Duero. So this is our artwork. In interpreting artwork related to malnutrition, art can be a powerful tool for advocacy and raising awareness about malnutrition by showcasing the human face of hunger. Art can inspire empathy and motivate individuals to take action. So, the use of color in our art, we use brighter colors that represent resilience or the hope for a better future. In art reflections of malnutrition, impact on communities. It serves as a visual record, a symbolic representations, a platform for social critique, and a tool for advocacy and change. That could be all. Daghang salamat.